What's up, healthy people? I'm Dr. Majd, host of the Majd MD channel, here to help save you a visit to the doctor. It's springtime, and just when you thought that the cold and flu season is finally settling down, guess what? Now it's allergy season. That means even more snot and fluid drainage. Yippee! But why waste time sitting at the doctor's office when the top 5 first-line treatments are all over the counter anyways? Before we review them, I just wanted you guys to know that the generic for these drugs is often less expensive than most people's copays for their prescriptions. Patients often tell me in the office that they're taking some type of an over-the-counter allergy medication, like let's say CVS Allergy or Allertech or whatever it may be called. The drugstores can actually call it whatever they like, but it's really the generic name that's important. And it's written right underneath the brand on the packaging in fine print, so pay attention to that because that's how you can compare apples to apples, and that's how doctors know what you're actually taking. And that goes for all over-the-counter medications, by the way, not just allergies. So I'll show you what I'm talking about. Here we go, check it out. Number 1, antihistamines. Well, they help dry up all of that fluid and snot in the face. And when you hear the word antihistamine, most people think of Benadryl, which is diphenhydramine, but it tends to cause sleepiness, and it only lasts about 4 to 6 hours. So what can you take that will last all day and not make you sleepy? Well, here are a few other antihistamine choices that do just that. Loratadine, which is the generic for Claritin. Cetirizine, which is the generic for Zyrtec. Fexofenadine, which is the generic for Allegra. Number 2, antihistamine eye drops are best for those with, you guessed it, eye symptoms, mainly itchy, watery eyes. Ketotifen, which is sold as Zatador, is one of those eye drops used for these purposes. Number 3, intranasal steroids. Now, before you get all hyped up, know that it's not the bodybuilding, bulking up type of steroid. Sorry, Arnold. Travel into the bloodstream is minimal, if any, and it simply attacks the back of the nasal passages and it decreases the inflammation there. It's really intended for those with a postnasal drip, which is that drip that flows from the back of the nose down through the throat, and whether you like it or not, it really happens to all of us. In fact, if you're clearing your throat right now, guess where that mucus you're clearing is coming from. Sorry to break it to you. Now, this drip can irritate the back of the throat, and it causes a persistent, annoying cough or sore throat in some people. An example of an intranasal steroid is fluticasone, which is the generic for Flonase. It's recently available now as OTC, and it takes a week's use to kick in, however. And there's a special technique to use it, so make sure that you review it with your pharmacist upon pickup. Otherwise, it may just not work as well. Number 4, nasal saline. Now, that will help clear out all of the allergens that are residing in your nasal passages. And some of my patients simply love their nasal saline, so give it a shot. Number 5, lastly, decongestants. If a snotty nose and a nasal congestion is really your main problem, then an as-needed decongestant can help open you up. But they're not intended for daily use, only for short periods of time for acute symptoms. Phenylephrine is the ingredient in most over-the-counter decongestants on the shelf, and it's a weaker type. Pseudoephedrine is a stronger decongestant, but it is kept behind the shelf, so you actually have to ask the pharmacist for it, but it is still available without a prescription. Decongestants can raise blood pressure and heart rate, however, so clear it with your doctor before you actually start taking it. And there you have it, 5 first-line treatments to treat your allergies, all OTC remedies without the need to even step inside a doctor's office. So I'd love to know who's watching, so please leave me a comment below or simply just say hi. And if you found the information useful, then let me know by giving it a thumbs up. And please don't forget to hit that red subscribe button right down below the video on the right, because you're not going to want to even miss one episode and miss all of this useful info. Please remember that all medical information presented here is for informational purposes only, and it's not intended as specific medical advice. So you should always seek your doctor for health-related questions and issues before instituting any type of a treatment or plan. Well, thanks again for tuning in. Stay healthy, and I'll catch you next time.